Hello, my name is Christopher Mitchell, and today I will be presenting information on celiac disease as part of the Module 3 assignment for Adult Health 2, in which we were to choose a gastrointestinal disease and go over a lot of the components of it. I chose celiac disease, and we shall begin. The pathophysiology of celiac disease includes internal mucosa damage as a result of consuming barley, rye, or wheat, or any food containing gluten. The disease does not affect any particular age group more than another, meaning that it affects people of all ages. The factors that contribute to celiac disease is genetic predisposition, immune-mediated response, and ingestion of gluten. A vast majority of patients with celiac disease have a human leukocyte antigen allele, HLA-DQ2, and a small majority of individuals with celiac disease have the HLA-DQ8. Chronic inflammation is the source of tissue destruction in celiac disease. A majority of the destruction occurs in the duodenum, as this is the part of the GI system that is exposed to gluten more than any other part of the GI system. Prolamines are peptides within gluten that are absorbed within the intestinal submucosa, and those peptides bond to the HLA, which then activate the inflammatory response of celiac disease. Diagnostic testing for celiac disease consists of serology testing, physical examination, obtaining medical history, as well as small intestine biopsy analysis. Histologic evidence is the primary way that the diagnosis of celiac disease is confirmed. And diagnosis should be made with diagnostic testing before the gluten-free diet is started, as the gluten-free diet can affect the results of the various diagnostic tests that are completed for celiac disease. Clinical manifestations in relation to celiac disease would include flatulence, foul-smelling diarrhea, malnutrition, abdominal distension, as well as staturia. In some cases, patients with celiac disease will not have any apparent GI symptoms, but will rather present with other symptoms such as iron and folate deficiencies, hypoplasia of dental enamel, peripheral neuropathy, reproductive system problems, as well as reduced bone density or osteoporosis. Interprofessional care for the client with celiac disease includes ensuring that the client refrain from gluten in their diet and providing information on foods that can be tolerated instead of gluten. Patients should receive a dietary consultation, and the nurse should provide continuous education on eating a nutritious diet within their budget that they can afford to still maintain nutritious maintenance. The client can be provided with resources for meal options that are gluten-free, as well as information of restaurants and stores that have mobile phone apps that will provide information of their selection of gluten-free options. The nurse should provide the client with places that gluten-free foods can be purchased, as well as educating to always read the food and medication labels before taking any medicine or consuming any food that they are unsure may contain gluten or not. Treatment plan, medications for patient with celiac disease really is they're going to be prescribed a gluten-free diet. And in some cases, if the gluten-free diet is unsuccessful in reducing certain symptoms such as dermatitis herpetiformis, there is a medication called dapsone that may be given if that rash is not going away within 6 months to 2 years of the dietary change. that medication will be given to help reduce that skin rash. And the treatment plan will consist of monitoring symptoms of celiac disease and always providing educational resources and continued education for maintaining a gluten-free diet. The plan of care for a patient with celiac disease would be utilizing the nursing process to develop a plan of care, which would start with assessing the client for any symptoms of the disease and their level of compliance with dietary guidelines. A nursing diagnosis should be made, and in this case can include nutritional imbalance related to malabsorption as a result of the effects on immune system when gluten is consumed. Planning should include information on changing diet to exclude gluten, better gluten-containing foods, as well as evaluating symptoms to report that can indicate complications such as malnutrition, diarrhea, and abdominal distension. The nurse should implement these interventions and evaluate the client's response to avoiding gluten in their diet. And follow-up appointments should always be set up by the nurse so that evaluation can be made based on the patient's response to their diagnosis and the lifestyle changes that have been made as a result of their diagnosis. Education, the nurse should focus on educating the client on how to avoid gluten in their diet by providing resources for meal plans that do not contain gluten, restaurants that offer gluten-free options, as well as teaching on why gluten should be avoided given their diagnosis. The nurse should provide the client with where they can find certain foods that don't have gluten, as well as educating on how to read food and medication labels properly to ensure that there is no gluten in them. The nurse should provide the client with written information for referencing dietary recommendations, symptoms of complications, as well as methods of preparing meals in which gluten is not used, which can be done with using gluten-free flour, gluten-free bread, and preparing meals that are not made where other foods that contain gluten have been made. And this kind of promotes the patient still having a liberal and independent diet where they can still eat the foods that they like to eat, just replacing the ingredients that contain gluten with ingredients that do not. Thank you very much.